my name is Alex Wong, and today I'm going to be talking about a research project that I've been working with through the Penn Emergency Department. I'm currently a research coordinator there, and I've been working on an ultrasound training program education research project that's global health related. And this is going to be basically the subject of my BFS talk, so let's get started. This was actually a project that was born out of Penn's emergency department and the Brigham and Women's Hospital affiliated with Harvard Medical School, as well as the nonprofit organization Pure, who sponsored much of this research in Zanzibar, Tanzania. So this poster is actually going to be presented very soon at a couple of upcoming conferences, so I thought it would be perfect to kind of use this context to discuss it further in front of an academic audience such as BFS. So this project, Analysis of an Obstetrics Point-of-Care Ultrasound Training Program for Healthcare Practitioners in Zanzibar, Tanzania, was a project that I worked on mainly through completing a lot of data analysis and data collection. While I was not on site, I was very much in part of the data collection process in terms of figuring out what data was pertinent to be collected, as well as writing the final manuscript, which should go out by the middle of this year. So let's get started. I'd like to first and foremost thank my collaborators on this project. Dr. Dean and Dr. Henwood both helped as co-PIs in terms of the overall direction, and Dr. Hall, the first author for this poster/project, was the main principal driver in Zanzibar, Tanzania. So with that, let's get started. So basically this was a project that was done in Zanzibar, Tanzania. Zanzibar is a semi-autonomous part of the United Republic of Tanzania. So it has its own Ministry of Health, it has its own governance, and I also have like kind of a picture right here, a graphical representation of the geography of Zanzibar. It's actually an island right off of the African continent, and the reason why this research was conducted there was because there's a lot of Penn-affiliated global health research there, and obviously with ultrasound there's a lot of relevant clinical significance in terms of maternal and newborn health. So in Zanzibar, Tanzania, maternal and newborn health are of critical importance because there is high morbidity and mortality. Morbidity is basically the health conditions that are associated with a specific disease, and then mortality is the rate of death. So Zanzibar has a high morbidity and mortality rate. There is limited infrastructure in terms of hospitals and access to care. In Zanzibar, a pregnant woman has an approximately 1 out of 200 chance of dying from pregnancy, and the child has a 6% chance of dying in infancy, so these rates are pretty high. And so basically this project was meant to kind of diagnose the situation, understand the patients and what they are coming in for, and then see if ultrasound is in something that can be taught in Zanzibar, Tanzania to a lot of intermediate level providers or midwives who can therefore go out and practice ultrasound themselves. Ultrasound, as many of you may know, is a safe, non-invasive tool. It doesn't have a radiation, so it's really great. It also has a learning curve that is independent of clinical experience. Basically what that means is that you don't necessarily have to be a doctor. There are plenty of ultrasound technologists here in the States and abroad where ultrasound technologists do not have medical degrees but can significantly contribute to clinical workflow, and that was kind of in the context that we were going from here. So the objective of this study was to analyze the feasibility and effectiveness of a point-of-care ultrasound training program for clinicians and intermediate mid-level providers providing antepartum obstetrical care for patients in a remote area of Zanzibar. So what this basically means is that antepartum obstetrical care, we're basically scanning different patients as they were coming in for their first or second, third trimester exams, and then providing them with the necessary care or necessary next steps in terms of how to best manage their obstetrics care and ensure a safe delivery. So this was a study that basically analyzed the performance of trainees in a 6-month longitudinal training program. It was sponsored by Pure, and all the trainees were trained by Pure trainers. Pure is an organization, as I mentioned before, that focuses a lot on global health, specifically in ultrasound, and many of the physicians there are affiliated again with Harvard and Penn as well. So this training program was done on clinician-performed ultrasonography in outpatient prenatal clinics and hospitals. There were a total of 3 clinical sites. And so these 3 clinical sites basically contributed to the approximately 1,000 patients that we actually analyzed, or sorry, 1,000 ultrasound exams that we analyzed for this study. Trainees, again, were a combination of midwives, clinical officers, and physicians. And these were principally from 3 different hospital sites, again, on Pemba Island. So Pemba Island is the main island in Zanzibar, because Zanzibar is actually a series of islands and small land regions. So the data collection that we did was from these 3 different hospitals. The primary outcome that we were looking at was trainees' performance on a final observed structured clinical exam, an OSCE. This is a standardized exam that is used to measure physicians' performance in performing a physical exam and written exams compared to initial written and practical assessment. So our goal was basically to have this ultrasound training program intervention look at the before and after effects and see whether or not our training program was efficacious. Our secondary outcomes included performances on the exams themselves, like the ultrasound exams, completed obstetric ultrasound exams during the entire 6-month duration, and we wanted to stratify based on educational background because it was interesting, or it would be interesting to see, like, if educational background had any bearing in terms of how steep the learning curve or how easily trainees picked this up. And finally, we used very simple analytical methods such as 95% confidence intervals, means, and medians to evaluate the effectiveness of this educational intervention. So with that, let's kind of go into the results real quick. So 85% of the participants had no prior ultrasound experience. Again, Zanzibar, many of the providers actually who are associating with obstetrics care tend to be midwives or mid-level providers. Health infrastructure isn't incredibly robust, so 85%, again, this isn't super surprising. Trainees completed a total of 1,338 ultrasound exams, which is quite a number. There were a total of approximately 99 exams per trainee over 6 months. So each trainee went through a lot of practice, and written exam scores, as you can imagine, it improved drastically from a mean of 33.7% to 77.5%. So clearly this training program did have some robust efficacy. Practical exam mean scores also improved. So practical exams, again being the OSCE, improved from 70.6% to 82.9%, which is phenomenal, especially given the fact that these were measured at the midpoint and final course evaluation. So even a 6-month training program, essentially within 3 months, we were able to close a gap that had a statistical significance. And 5 of the 13 trainees completed all training requirements, including 75 proctored ultrasound exams. During this time period, some of the trainees were, in the beginning, of course, they were trained by pure trainers, which include a lot of physicians, again, from Penn and Harvard. And then a lot of times they achieved proficiency and started independently performing these ultrasound exams as well. So in total, as you can see, the breakdown in terms of the trainees, there were 13 trainees in total. They were split between district and referral hospitals. Most of them were midwives/nurses. Again, that's kind of the standard, reflective of the standard health system that's present currently in Zanzibar, Tanzania, and only 2 physicians actually. The total, as you can see in the number of exam questions and the number of correct answers, the percentage obviously increased over time, and during pre-training, it's very notable that 0% passed, but then post-training 77% passed. For the OSCE exam, again, 23.1% passed in the beginning, and then 46.2% passed at the final exam. So very notable in terms of the overall improvement, both on the written and the practical hands-on portions. So kind of Summing up the results, about 40% of the participants successfully completed the training course at a level of proficiency for independent practice, which is really notable, especially in the global health context. And students who were most successful were also those who were able to perform the most number of scans, given the fact that ultrasound is a operator dependent technique, and so a lot of times you really have to get your hands on the device, the machine, in order to get to a specific aptitude. Although to note, this had a p-value of 0.034, so this was more of a comparative observation rather than a statistically significant finding. And trainees with higher levels of education performed better on the written and OSCE exams. So as you can imagine, with implementing a training program like this, there were multiple challenges that had to be overcome in terms of implementation. So successful identification or measurement of the femur was the greatest challenge. And when femur measurements were excluded, overall passing rates scores went up from 46.2% to 69.2%. And final exam passing rates rose from 38.5% to 61.5%, which is really notable because identifying the femur during the ultrasound exam, the obstetric exam, is quite difficult. And so when you remove that bottleneck, that mainly was the principal reason as to why trainees kind of struggled with the training program. Other challenges include language barriers, reliable electricity, a lot of kind of often observed phenomena within a global health context. For example, absences due to illness, family death, limited trainer availability. And again, these are kind of independent of the training program, but still very much important challenges that any kind of global health intervention must heed and take note in order for the success of the implementation to be successful. And finally, in terms of assessing the training program viability, a one-week Train the Trainer course was completed in February 2018. And basically what the goal of this was to have these trainees who completed all the requirements become trainers for the next set of trainees. Because in global health, one common issue is that longitudinal training or longitudinal care is very difficult to achieve. And our goal with having a program such as the one in this study is to have something that can be passed along and can basically operate autonomously. So in conclusion, trainees improved significantly on many measures, on all measures assessed in this study, written/practical exam score after a 6-month longitudinal ultrasound training program, which is quite notable. And while reasons for there being a low completion rate are unclear, there are obviously inherent challenges with working in the global health setting / resource limited setting. And again, these providers are doing this training program in addition to their standard clinical workload. So that is something that's important to be cognizant of in terms of the successful implementation of this program. In terms of further direction, additional investigation could be done to look at long-term retention, whether successful trainees become trainers and we have a robust program after maybe, say, 2 to 5 years, and the long-term impact of having a program like this in terms of health outcomes, epidemiology, and mortality/morbidity rates within the 3 clinical training sites that we evaluated. So with that, thank you so much. This was a project that I worked on for basically the latter half of 2018 and into 2019. So I'm really proud of the work that we've put together, and there are clear implications from this project and also the clinical evidence, which we will probably be publishing sometime in the latter half of this year. Thank you so much.